a place to come and kind of like, be with my son,
Valerie Gray now knows the final resting place.
It's right here.
For her 39-year-old son.
Where it says Michael Vincent Gray.
Solace after so much uncertainty. And she's not alone in that.
That's so beautiful of you. Thanks.
Peace be with you.
Oh, you're so sweet. Oh,
Sorry for your loss.
I'm sorry for your loss too.
Ginger Kanji lost her 31-year-old daughter, Jessie Peterson.
Your daughter was beautiful.
The two mothers
She was.
He's handsome.
Oh,
met for the first time.
he was something else. He's with me every day.
United in their message.
Whatever it takes, I think something needs to change.
I'm with her. Accountability. There needs to be something to stop this.
For Valerie, it was 1 month. For Ginger, 1 year. Time waiting and wondering before they say they learned their children, who they reported missing, had died at Mercy San Juan Medical Center in Carmichael, a Dignity Health hospital.
Every time I see commercials, dignity, they don't have any dignity.
KCRA3 Investigates revealed the California Department of Public Health looked into complaints about the hospital last year and found it failed to follow policies related to family notification of patient death, timely completion of death certificates, and processing of patient remains. It said that contributed to the prolonged storage of patient bodies in an off-site morgue. Storage in the case of more than 24 patients that lasted anywhere from 1 to 2 years.
It's just disheartening to know that it could have all been prevented.
As the state regulator, CDPH actually flagged issues at Mercy San Juan as early as 2022 for, again, not properly notifying family after a patient died and for a doctor failing to complete medical records on time. In 2023, another concerning discovery. A CDPH report shows after a patient died, the hospital moved the body for storage, but no one documented where, causing the patient's son emotional distress, uncertain of his mother's whereabouts.
They were aware of their shortfalls and they didn't do anything to mitigate it.
The hospital was supposed to. Each year, Mercy San Juan came up with a plan of correction, and each time, CDPH then declared the hospital in compliance, even though we now know the hospital didn't follow through on all of its planned fixes. In interviews with CDPH last year, the quality director said, "I'm not familiar with these plans of correction, and no one was working on these."
There's got to be a way to hold them accountable.
We wanted to know what systems are in place on a state level to make sure hospitals are following through on fixes, and what enforcement can CDPH take if hospitals don't. So 2 weeks ago, we asked to interview the CDPH director, Dr. Erica Pan.
We had a multi-agency workshop where we walked through all these scenarios.
We also asked someone from her communications team to give us a call. They're paid to communicate with the media and the public. But CDPH declined. No one would talk on camera or on the phone, and our last email went unanswered for days.
Hi, Lizzie Mitri with KCRA.
So I introduced myself when Dr. Pan finished speaking at a joint Senate committee hearing on Wednesday.
Do you have a moment?
Our press team has your...
Dr. Pan said she had to be briefed on this.
Will CDPH be holding Mercy San Juan accountable?
I can't answer these questions right now.
Do you have any message at least to the families who've been impacted, who just want to know if CDPH will take any enforcement action or do anything for them?
So thank you so much. We are going to get back to you through our media team.
After that, we did finally get a phone call from the communications team, but they say they don't have enough to share for an on-camera interview. Instead, they emailed a statement from Dr. Pan. She says, in part, our top priority is to ensure patients and their families receive high-quality care from the facilities we license. In this case, the hospital failed to provide timely notification to families following the deaths of their loved ones, which is unacceptable, she says. We want families and all Californians to know we are working with the facility to ensure changes are made to prevent additional harm.
Well, way to track them down, Lizzie. And what does Dignity Health or the hospital have to say about this?
At this point, nothing. Dignity Health and hospital president Michael Corpiel did not respond at all to our request for comment yesterday.
All right, Lizzie, thank you.